Well, I'll be honest with you. I don't want a terrorist incident to define my life. But on the other hand, I wouldn't change a thing. I did everything in my power to help people, and I have no regrets, and I would do it again tomorrow.
This is where they boarded me into the fireboat. And you see my face right there. I'm not looking too good. It takes a village. And this is a village. This is firefighters from all different companies that responded to carry me out. And then Prezant took over. And Prezant carried me out for the last 20 years. And he's still carrying people out.
The fire department has a tradition of honoring the people lost in battle. And there's a plaque, a memorial wall down on the lobby of our main headquarters where you can see all of the firefighters and our EMS members that died in the line of duty. It's way too many people. On some years, it's been 3, 5, too many. But with 9/11, 343 were added in just one day. And we thought at that time that that would be the end of it. But those of us taking care of these patients realized that, unfortunately, it was just the beginning.
I remember everything about 9/11. I remember everything. It was beautiful. It was a clear morning. It was you could see forever.
Well, the morning started out with me, as always, headed into work, and then hearing that a plane had crashed into the World Trade Center.
I commandeered the Smoke, which was a spare fireboat, and we had filled it with medical supplies, and we cast off.
I started witnessing civilians jumping. And that has always stayed with me. It has never, ever left. To be able, I just wanted to get up there and do anything I could to assist this poor, innocent people making their decisions as to their manner of death. And then sure enough, a plane passed us.
I reported to the command center where the chief of department was present, Chief Peter Gansey. And Chief Gansey said that I should head towards the South Tower and help with the triaging of firefighters, EMS providers, and civilians as they came out of the building.
I started seeing the South Tower, which was the second tower to get hit, started buckling, and I went, oh man, it's collapsing.
Everybody started running towards the river. And everything started raining down on us. I think we all thought we were going to die. I certainly did. Though I was buried in rubble, I was able to dig myself out.
The noise was just, it was a freight train coming at me. And sure enough, it stopped, everything turned black. There was no air to breathe, but I realized that I survived.
After the first tower collapsed, and now it was very clear to everyone, the second tower was going to collapse. More firefighters ran into the second tower. Fire chiefs, officers, the chief of department ran into the second tower to help evacuate.
What I saw these individuals doing, they were saluting as they were going in the building. It was unbelievable. All of a sudden, the chief came out, what was left of the Marriott Hotel, and says that there were people trapped in what was left of the Marriott. So now I give them the signal, get out, get out. And I'm screaming at them, get out, and they weren't getting out. And then all of a sudden I heard that freight train again, and I looked up to see the North Tower rapidly coming down, and I couldn't run, with the debris, so I just turned around and I put my hands over my head. I figured the time on this earth was over. I crouched down, I said the Hail Mary, and that was it.
Al Fuentes is a miracle. He was caught in the collapse and completely buried. Not just in a little rubble like I was, but he was at ground zero. The building fell on top of him.
We need some relief here. We got the collapse unit. This is Captain Fuentes, a couple other members, guys.
All right, we have help on the way to you, Capt.
I heard Al Fuentes, Captain Al Fuentes, over the radio, and I could tell he was in trouble. So I made it my mission to go and find Al.
This firefighter, Jack Flatley, gave a report.
3 Battalion Chief Fuentes is trapped. I have him. It's Flatley from Rescue. West Side Highway. I need some help getting him out.
And that's when Terry and all of them started coming.
We started carrying him through the debris pile. He was semi-awake and confused, and told him to hang in there.
And they took me to the water's edge, and by fireboat, they brought me to Jersey City Medical Center. This picture here really talks to me a lot, with this fireman with his head down. As they're carrying me out, because I think I died. Part of me died there. I think they're saying goodbye to me.
When you see a patient in the ICU with the massive injuries that Al had suffered, you know that over 50% of those patients are not going to survive. And how do you tell that to the family? You've got to set a balance between truth and hope.
He spent a lot of time talking to me and asking me how I was and concerned about my well-being. And then he went in, he examined Al.
In those situations, my job is to liaison, to try to explain to the families what's going on. And then to make certain, to the best of our abilities, that everything is being done for him.
Dr. Prezant came every day. He communicated with me consistently. I just trusted him emphatically. I just said, okay, if Dr. Prezant says this is what we're going to do, this is what we're going to do.
The greatest moment of my life, and I'm not exaggerating, is when they turn around to you having never met you before and saying to you, I know who you are, and we're going to do everything you say. That just means that your life as a physician has meant something.
My first memory is I'm in Montefiore Hospital. They moved me to the second hospital. And I well remember seeing them the first couple of times. I was spaced down, he would look at me, and we'd hug. I knew then that he was the guy. We hugged and we talked. I said, well, I need to talk to somebody. I just felt we didn't do enough. I have this PTSD, whatever you want to call it, this survivor guilt, which I know I had. But we took it step by step, you know. And Dr. Prezant has been with me, you know, for 20 years.
The air was terrible. The first day, I had great breathing difficulty. At one point, I had to give myself oxygen. So then I called up the medical office and I spoke to Dr. Prezant.
And I said, you know, come on down to the Bureau of Health Services. We're here to help you. He said, I'm just too busy. I mean, there's just too much work that needs to be done at ground zero. There's still people buried there, and we might be able to find some. And this was no different than almost every other firefighter, EMT, paramedic, people throughout New York. They wanted to help. And you couldn't stop that. So, you know, I just told him that we're here for him, and get back to me when you can.
I went down to see Dr. Prezant. He had the test results in, and he more or less told me that I'll never go to another fire again, you know. So at that point, which was the last thing I expected to hear, my whole world turned upside down.
Those of us taking care of these patients realized that, unfortunately, that there would be different illnesses, cancers, COPD, emphysema, that would result from these exposures. 4 weeks afterwards, we started the World Trade Center Health Program. In addition to monitoring and treatment, there is a research component.
Because you then have to say that PFT is what we are using to develop the score for that interval. It's
Good point.
participant-specific, not interval-specific.
Yes. That research component has allowed us to shift from compassion-driven advocacy to data-driven advocacy. And that changed the entire approach to World Trade Center funding. When we first went to Congress in 2002, it was, yes, our hearts go out to you, but these are symptoms and they'll go away. And working with our staff, our collaborators at Montefiore Medical Center and Albert Einstein College of Medicine, we were able to show that, on average, lung function did not recover, that this was a permanent, dramatic decrease in lung function. 7 years later, when we went to Congress, the story had completely changed.
Clearly, we need a long-term solution, and we hope to receive a commitment from the Senate, the House, and the President that matches the commitment FDNY firefighters and EMS workers and many others made on 9/11. Every FDNY firefighter and EMS rescue worker in our program suffered intense exposure with health effects that could be objectively quantified because our program had the foresight to collect pre-9/11 health data, including breathing tests, on each and every one of them.
Once we were able to get a fully funded World Trade Center Health Program, we were able to do all the things that you would want if your family was down there. We developed a massive post-traumatic stress disorder treatment program. We were able to do research that benefits people. Example of this would be our identification that cancers were happening at an increased frequency since 9/11. We now are able to identify cancers at their earliest time period, and we have just published data demonstrating that in our cancer patients, mortality is decreased. Because when we find something, we are able to do something.
All of us survivors, I don't think we'd be in the condition we're in now if it wasn't for his advocacy and him constantly fighting for us and caring for us. He cares for me like I'm a brother. And he's the best, aside from my lovely wife, he's the best advocate that could be had.
Terry is a very strong-willed person. I think his personality really helped him to deal with this. The endless doctor visits, walking around with an oxygen machine. He is very determined to enjoy his life, to be there for his family, so it's hard for him to say that he can't do something anymore. So we just kind of live with a plan B. He always says, I'm going to be here as long as I can, so I'll do whatever it takes.
My wife and I, we always walked. We'd go to the boardwalk and, you know, the conversation, clear our heads. And so I can't walk anymore, but I love doing it. So now I purchased an electric chair. So we still go on our walks. And I guess what I'm trying to say is whatever I had to do to keep life as normal as possible, that's what I do. I love life, I cherish it. And my family is my whole world. Part of the reason why I'm able to put things behind me is the support that I get from my wife and children. And the hugs and kisses I get from them and my grandkids. And I've been very blessed my whole life. So where other people might look at me and say, oh, man, how does that guy deal with it? You know, his medical issues, and I don't look at it. I put that behind me. I'm looking forward.
I try not to forget that, you know, hey, I'm here today. A lot of guys ain't here today. They didn't die as victims from a terrorist attack. They died as heroes. Over 25,000 lives were saved. While it was our worst day, it was our finest day. And I would never forget that. And you know, I've been given a gift. You know, I've been given life, and I've been blessed to have a beautiful, loving wife that's solid as a rock. That, you know, 41 years and having my kids and my grandchildren. So, you know, I've been, I just, you know, I'm here. I woke up this morning, who's better than me, you know? So I feel good, I feel good.
Look at him. Grab it, Ducky. Here, here's a one more. See who gets it.
Hey, Al. How you doing, buddy?
Terry, my brother.
How you been?
Good to see you, baby.
Good to see you, too.
Good to see you.
How you feeling?
I'm doing good.
You look like
I don't complain, man. I don't complain. Good
No
to
sense
see you.
complaining, right?
Yeah,
No
you
one's
kidding?
listening.
Nobody listens at all, man.
I don't think you can put words on the value of what Dr. Prezant does, the whole scope of what he offers and what he's done over the last 20 years. From that day, for lack of better words, like a security blanket, you know? He's our lifeline. Life after 9/11 is about perseverance. And you just persevere. And that's what he does. He just perseveres. He's always moving forward.
Hey,
Big guy.
good to see you.
Good to see you, Doc.
Bob, what isn't that, sir? Good to see you, Terry.
Good to see Terry here.
Yeah, have a seat.
Oh, man.
It's pretty amazing, huh? It's like the team is getting together again.
Yeah.
Now, when was the last time you saw Terry?
That had to be maybe 10 years ago.
Oh, easy, 10.
Yeah, or better.
Like, this is part of the recovery for me.
Yeah. Yeah,
You know,
seeing Terry.
this is part, see Terry and go over some of the things, and that's part of my recovery, you know. I don't think we'll ever end.
I don't think we'll ever get past it. We'll learn to live with it.
No.
You know.
Yeah, and you know, I tell Terry, I said, you know, for me, you know, the glass is always half full, and no matter what I do, I don't care. I'm gonna keep going to. I'd rather die trying.
Patients, when they trust you, share some of the most intimate thoughts with you. The things that my patients share with me about 9/11, a lot of that occurs because they trust me, but even more occurs because they knew I was down there as well. In terms of PTSD, grief after the loss of their coworkers, family, they've shared more with me knowing that I've lost loved ones. And that is, it's an honor, it's a privilege.
Love you guys.
Love you.
Yeah. Take care, brother.
But it's also just an amazing, it's an amazing experience that defines humanity, that defines a connection between people. And I'm having that every day.